Welcome to the Informed Pregnancy and Parenting Podcast. I'm your host, Dr. Elliot Berlin, and you have tuned into part 2 of a before and after journey. We are back with kindergarten teacher turned occupational therapist Heather, who we last talked to at nearly 39 weeks into her pregnancy, and she had been planning a home birth after cesarean, but found out the baby was breech. Her doctor offered only one option, which was scheduled cesarean before her due date, and then she interviewed a couple of other doctors who offered the option for vaginal breech birth, and talked about how she really loved one of those docs and decided to go with him, and then gushed endlessly about how awesome he is. Right now in the studio, we have both Heather and Dr. Awesome, who is wearing a cape, and also has appeared on several episodes of our podcast previously, including Breech 101, The Gentle Cesarean, and Preterm Labor. Heather and Dr. Emiliano Chavira, welcome back to the podcast.
Thank you.
Hello.
All right, so seriously, last time we left you, just to recap a teeny bit, you wanted to have like this all-natural birth with your first baby, and then you had a Funic presentation. Just remind us what that is.
The cord's in front of the baby's face looking like it could prolapse if I went into labor. So the ultrasound picked that up at 36 weeks. She was head down, but the cord was...
She was head down, but the cord was in not a good place?
Yeah, it was covering my cervix.
And so, Doc, is there any way to deliver that safely vaginally?
Probably not.
And that's what your doctor said also.
Based on the fact also he saw it, she was pressed against it, so there wasn't like room that it looked like it was going to float away again, the cord. It looked like it was wedged.
So, yeah, and I mean, that's a very unusual circumstance. We see very few Funic presentations. And I think probably the explanation is her placenta is somewhere down in the lower half of the uterus, and the cord is attached to the placenta somewhere low down on the placenta. So the cord is actually attached somewhere down in the lower end of the uterus, and that's why it's just all kind of bunching up down there.
It's not going to move anywhere.
Yeah, unlikely.
Okay, so you had the option. Your docs really wanted you not to go into labor at all costs. They were wanting to induce you as early as 36 weeks.
Yeah, the OB said, I've never seen this before. I want to refer you to somebody. So I went to see an MFM, and he goes, can you have a C-section today?
Oh, wow.
And I said, I have finals in a week. And he said, you can't go that long. He goes, I can give you till Tuesday. That was a Friday. So,
and your OB had been your gynecologist since you were 12.
Yeah.
And so practicing for a long time.
Yes.
And said, I've never seen this before.
And his partner who delivered me, who's practicing even longer, had never seen it before.
Wow.
It's like 0.06%.
Right. That's a really tiny percent.
It's like a joke my husband and I have about our luck with things. Good
medical
luck
risk?
Yeah.
Whenever they say, oh, it's really unlikely to happen. Okay. So you had a cesarean birth with that one. And also the way you described your cesarean birth was very you, too. Like you wanted to be aware of everything. You couldn't feel a thing. You wanted to see it. They wouldn't let you see it. And your husband was standing by your shoulder calling the shots. Now they're cutting through this layer. And you just wanted to know as much as possible.
And I wanted to see my baby. I heard her crying for a long time without actually seeing her. That was really hard.
Right, they took her away from you to the other side of the room.
Yeah, I didn't get that gentle C-section they talk about where they put the baby on you right away. They just, quickly take her, and that was hard.
We have talked about gentle cesarean with Dr. Chavira. There's a whole episode, in case you're curious at home. And then, so you said, okay, vaginal birth after cesarean. And even that wasn't an easy decision for you. You went back and forth about the risks and the benefits of doing a VBAC, and somehow you landed on the fact that you are going to do it, and you're not going to do it at the hospital. You're going to do it at home, at a birthing center with a midwife. It's all coming back to me now.
Yeah.
And your husband, who doesn't like change, you kind of had to talk him through each of those steps. I want to do the VBAC and I want to do it at a birthing center. And he came on board.
He did.
Your Bradley husband coach. And then just when everybody was on board with the exciting new plan, breech baby.
Yes.
Frank breech baby.
Yeah.
And you did everything. You stood upside down on your head. You did the chiropractic acupuncture massage, burned the funky stuff at your toes.
Yep. Spent a ton of money.
Lots of money.
Talked to my baby. Said, invited my baby to turn, all kinds of stuff. And an ECV we tried too.
You tried the external version? Nothing. That baby did not want to turn. So usually when, there's a whole bunch of obstetricians in this town who will support vaginal birth after cesarean. Very few who support vaginal breech delivery. What we didn't know at that time is, would anybody support a vaginal breech after cesarean? Or a vaginal breech birth after cesarean? A baby back? I don't know what you call it.
Yeah, my OB, he was totally on board for the VBAC.
Right.
And then...
Was he on board for the home VBAC?
I didn't.
He didn't know.
No, I didn't. I every time I had an appointment, because I was still going to him for my checkups and stuff, and I was like, I'm gonna tell him, and then I just didn't want to see his reaction, so I chickened out on telling him that I wanted to do like a home/birthing center birth.
Because you were doing co-care. You were seeing him and a midwife at the same time, but he didn't know about that. And you were going to tell him in your defense. You just never got a chance because he first told you breech baby.
Yeah.
And he said, no way, we're not he said no ECV.
He was so kind about it.
No, I'm not saying in a bad way.
Okay,
I'm just saying from his comfort zone.
Yeah.
His clinical opinion was we shouldn't do an ECV because of your previous cesarean.
I think so. I don't remember that part.
You have to listen to the before episode.
I think he did.
That's where
There's so much that has gone past.
Transpired.
Yes. Because of the scar, the previous C-section. He thought the risk of doing the ECV would be too high for like some sort of uterine rupture, and then he said I had two choices this time. I could either schedule the C-section,
right,
or wait to go into labor and then have the C-section.
Oh, I thought he didn't even want you to do that.
No, he did this time. He did it because he said a lot because he knew how badly I wanted the vaginal birth, and he said sometimes women feel some sort of satisfaction if they're able to actually go into labor and feel the contractions before having the C-section.
It's funny that you say that because we made a movie about vaginal birth after cesarean called Trial of Labor, and in doing interviews before and after that film with people who were on the VBAC journey, on their own VBAC journey, I originally, in my mind, never having given birth, I thought that if you'd like to go for a trial of labor after cesarean, the three, let's say, most common options would be that you labor and then give birth vaginally, or that you labor and end up having a cesarean anyway, or that you don't even try, you just go for the scheduled repeat cesarean. And I thought the order of preference would be for most women, if they're entertaining VBAC, would be that they labor and give birth vaginally, and if not, that they just schedule a cesarean. And the worst case scenario is that you labor and then have a cesarean anyway. But here's something interesting that and it's not a very big group of women, but it's a significant number. All of the women who had labor with their first baby and then a cesarean, and then just scheduled the cesarean the second time around with no labor, all of the women that we interviewed did mention that it was really odd not to have labor and that they sort of wish they had the opportunity in retrospect to have some labor, maybe not even a lot, just some labor before the baby was born.
I get that. That makes sense to me.
And that's what your doctor was touching on, that even if you end up having a cesarean because the baby's breached, that maybe you would want to labor first a little bit.
Yeah.
Is it, and there's different clinical opinions on everything, but Dr. Chavira, if obviously in your case you didn't feel like having had a previous cesarean rules out automatically doing an external version.
Yeah. So I think this notion that if you do an external cephalic version that puts the mom at risk of tearing the scar open that's on the uterus, theoretically that must be possible. However, there are studies on this.
Oh, really?
External cephalic version in women with prior C-section, and they're fairly small studies. Let me make up a number, maybe like 100 women, 130 women, something like that.
That sounds like a great made-up number.
But they did not have any cases of uterine rupture. So that doesn't mean that it's impossible and there's zero risk, but it just means that the risk must be something lowish.
Well, less than 1%.
Yeah.
If there were indeed 100.
Yeah. And in the American College of OBGYN guidelines on external cephalic version, they get into that and they sort of say it's an unknown area, but it's not listed as a contraindication.
Mm-hmm. So are there contraindications to doing ECV?
That's a very interesting question because it's the answer has been under evolution for a long, long time. It used to be that if you would read these guidelines by professional organizations, and that includes ACOG, which is the American one, and including professional organizations from around the world, there always used to be long lists of contraindications. And what has happened in recent years, if you track this, people have started thinking, maybe all these contraindications that we're citing, they're really just theoretical. And what is the evidence out there that these scenarios actually make the external cephalic version more dangerous? And so people have actually systematically looked at all these things and found that there's actually very little scientific evidence proving that these historic contraindications actually increase the risk. And so when you look at the guidelines, you start to see that these long lists are getting shorter and shorter and shorter. One clear contraindication is anything that contraindicates vaginal birth. If you're not going to have a vaginal birth, there's no reason
to do an ECV. So,
for example, if you have a placenta previa, it wouldn't make any sense at all to do an external cephalic version. I did a C-section on a mom once who had a 12-centimeter fibroid tumor in her cervix. There was no way that baby was going to deliver vaginally. Wouldn't make any sense to do an external cephalic version.
What about if she had extreme rib pain from that head tucked underneath her rib cage?
I don't think pain would be a contraindication to doing it.
Not a contraindication, but let's say she couldn't have a vaginal birth for some other reason, but still wanted to get the head out from under her rib cage.
Oh, I see. Then you're doing something that has no data behind it.
There's no study of 100 women who had pain under the rib, but otherwise couldn't deliver vaginally. And we tried an ECV.
Right.
Yeah, maybe we can write that study.
I had pain under my ribs.
But you could deliver vaginally. Perhaps. We don't know what happened yet.
Okay.
All right. So your doctor talked, Heather, your previous doctor talked about risk tolerance. And I guess this is where, this kind of falls under that conversation where doctors, I think, sometimes have to make a decision with you or sometimes they make it for you based on risk tolerance, partially your risk tolerance, what kind of risks, medical risk you're willing to take for yourself and baby from, on either side of two different choices about a decision you have to make, two or more choices, but also for themselves, for how much liability they want to take on. And I say all the time on here, risk to you, medical risk is not necessarily equal to risk to us. Liability risk, sometimes things are risky for a doctor that are not that risky for a patient. And the doctor doesn't want to do it anyway because he doesn't want to take that risk or she doesn't. All right. So, but you switched over in the end because, so after deciding to do a vaginal birth after cesarean at home, then finding out that you're breached, then trying everything you could do to get that baby to turn, you decided to still go for a vaginal birth with your breached baby.
Yeah. And I tried to convince my OB. I kind of begged him because he's done breech deliveries back in the day. And he really wanted to. He said if he were going to gamble, he said probably 10 out of 10 times everything would be fine.
Go great.
He said I just can't put you at any sort of risk, and I have a feeling that also meant for him, like you were saying, the liability. He talked about the medical legal community was just not conducive.
Yeah, and it's not, for him, it wasn't about the VBAC. It was just about the breech.
The breech.
Even if it was your first baby.
Maybe a combo breech VBAC. He had said if you had delivered vaginally before, he would do the breech delivery.
He would have done a breech VBAC if you had...
No, but I wouldn't have had a VBAC.
Well, if it was your third baby.
Oh. Well, here's the other thing he came back and said later, because I did maintain, I spoke on the phone with him several times after. He said, well, do you guys want to have more kids? And I was like, well, I don't know, maybe. He said, well, if I'd known that if you want to have a third kid, then I'd be willing to do your breech delivery because the idea of having 2 C-sections would make it, I guess, more risky for
He'd
the
be
third.
willing to do your breech VBAC?
Mm-hmm.
Oh, really? That's interesting.
But it was like on the phone after I'd already made my decision and told him my decision. So I don't know if – who knows? He could have said that to me in the office, but he had asked my husband and I in the office if we were going to have other kids, and my husband was like, nope. So he's like, okay, well then we're doing it this way. But
yeah,
I don't know. It was interesting.
So I'm going to take a diversion back to Dr. Chavira. In general, what are the risks of delivering a breech baby vaginally versus just doing a repeat cesarean or a cesarean in general?
Yeah, so the risks of a vaginal breech delivery, it basically comes down to there can be injuries to the baby during childbirth in a very small percentage of cases. And those injuries can range from pretty mild things to, in incredibly rare cases, very severe injuries.
That don't happen to head-down babies?
Actually, the same kind of injuries can happen to head-down babies. It's just that the rate may be a tiny bit higher for a baby that's being born breech compared to a baby that's being born head-down. So, for example, it's been calculated that the risk of baby dying in childbirth, if the baby delivers breech, is about 1 in 500.
Versus?
And so the alternative would be to do the C-section, and the risk is about 1 in 2,000.
Mm-hmm. So it's a significant reduction.
I don't know. I think that's sort of subjective. What is significant? 4 out of 2,000 versus 1 out of 2,000. I think it falls on the individual to decide if they think that's a meaningful difference or not.
It's a reduction.
It's a reduction.
That comes potentially with other costs. Even like Heather was saying, if she's going to have more children, then the next pregnancy can easily be more complicated because of the previous cesarean or previous 2 cesareans.
Right.
Are there ways to minimize those risks? Are there some pregnancies that are more likely to experience those risks with a vaginal birth than other ones?
Yeah. So there are lots of ways to reduce the risk. One is to ensure that you're delivering with an experienced provider. So I think in Heather's story where she's talking about a practitioner who has been trained in breech birth and has done breech birth, that's a reasonable idea to entertain. When I talk to women who are really wanting to do a vaginal breech birth, one of the things I say is that let's just imagine you end up in some hospital somewhere and you encounter a physician who maybe they're younger, maybe they've never done a breech birth. I really would not recommend trying it with somebody who doesn't know what they're doing. Mm-hmm. I think that's definitely
that makes sense.
Makes it a much more risky proposition. There's one very interesting study that came out of France and Belgium, which is a region where they have continued to routinely offer vaginal breech birth to moms. And this study, what they did was they just recorded outcomes for a period of years, and they collected about 8,000 breech births. About 5,000 of the women opted for C-section. About 3,000 went for the vaginal route. This particular study showed no difference in outcomes between the vaginal babies and the C-section babies.
Oh, that's interesting.
It is very interesting. And one of the differences between this study and other studies is that they outlined in detail what their protocol was. So a lot of the breech birth outcome studies, you kind of have no idea who was doing the delivery, what techniques they were using, what their criteria were. You sort of don't know. Mm-hmm. This study is different because they outlined that, and so there were certain birth weight criteria, like something between 2,500 grams and 4,000 grams. Which is 2.5 kilos to 4 kilos. The babies were at term. It was either a frank breech or a complete breech presentation.
So the butt was down.
Yeah, and they utilized continuous fetal monitoring during labor. So, one thought is that if you're evaluating a mother and she sort of meets all those criteria, then you could say, well, this study was called Premota. You sort of meet Premota criteria, and in that study, there was no extra margin of safety from doing a C-section.
Interesting.
Another thing that I think makes births safe is that historically the way OB doctors were trained to do these breech births is with mom in what's called lithotomy position. So she's laying on her back, maybe her head's propped up a little bit, but the feet are up in stirrups. What a lot of the breech centers are doing now, particularly in Europe, is mom is on all fours. And so there are, number one, MRI studies where they took moms and they stuck them in an MRI machine in a squatting position. And what they discovered from those studies is actually just being in that position opens the pelvis by 2 centimeters.
Wow.
Which is a very significant clinical difference. Beyond that, there was a study that came out of the Breech Birth Center in Frankfurt, Germany, where they compared breech births with mom on all fours to breech birth with mom on her back. And it turned out when mom was on all fours, the C-section rate was lower. The maternal injury rate was lower, so big vaginal tears and so forth. You got less of those if mom was on all fours. The need to do special maneuvers to get the baby out was lower percentage if mom was on all fours. And the fetal injury rate was lower if mom was on all fours. So I think maternal positioning is another thing that can be done to make the breech birth safer.
When Heather came to you and she had both the desire to do a VBAC and to deliver her breech baby vaginally, do those two separate issues compound each other?
In my mind, no. They're two separate issues. And we spent a lot of time talking about VBAC. And then we spent a lot of time talking about breech. But I don't really know in any way that one affects the other.
Okay. So at the end of the day, you decided to go forward. You both decided to go forward with each other. Mm-hmm. And, in my mind, I'm only picturing for your poor husband who doesn't like change, how it must have been to switch doctors, now not do a out-of-hospital birth, but go back and do a hospital birth to deliver a breech baby vaginally, and then also not even your OB and hospital, but a new OB and a new hospital.
That was hard for him. Yeah.
Yeah, I imagine it's hard. But you did say in the last episode, like, he doesn't love change, but at the end of the day, he likes when you just say, this is what we're going to do.
Yeah. He comes around that way.
Yeah. Is that how it went down?
Yeah. Well, I don't tend to say this is what we're going to do, but I will say I really want this.
And then he comes around to it.
Yeah. And he usually pretty much with most things will say, okay, I'll support you. And I know it maybe in his mind he's maybe having some conflict, but he won't tell me about that.
Well, even you were having some conflict.
Oh, yeah.
Towards the very end. All right, we're going to take a little break. Last time I saw you, you were literally, I think, 38 or 39 weeks. Mm-hmm. And even like before the podcast, I was getting text messages like, having some contractions, not sure what's going to happen. Maybe I'll see you tonight, maybe I won't. But then we got through our interview, and then some more time went by. Let's take a little quick break, a little commercial break, and we're going to come right back with Heather and Dr. Chavira and find out how your birth went. If you're worried about pesticides, endocrine disruptors, and other toxic chemicals, you're probably shopping in the organics aisle. Certified organic personal care products give consumers extra assurance that what they are getting is exactly what's on the label. There's really no other certifiable way to know if your deodorant contains worrisome chemicals hiding behind a term like botanical fragrance, or if an ingredient is a bundle of other chemicals listed as a proprietary formula. When a product is certified organic, it means that someone is checking the statements they make. A company can't be organic just because they say so. They have to go through an all-day, everyday commitment, yearly fees, and extra scrutiny by the third-party organic certifiers to get an organic designation. Earth Mama Organics is one company that has been certifying its products for over 10 years. There's a real nurse and herbalist behind the formulations and a real commitment to making safe, effective, organic personal care for pregnant women and the babies they're carrying. From safe organic deodorant to lanolin-free nipple butter to comforting postpartum down there care, to effective and gentle baby wash and lotion, Earth Mama is there with something made with love and organic ingredients. To find a retailer near you, go to earthmamaorganics.com and use the store finder. That's earthmamaorganics.com. Check out the Doing It at Home podcast, hosted by Matthew and Sarah Bivens. It's a show dedicated to empowering stories and resources around home birth. Matthew and Sarah started the show as a way to document their own pregnancy and birth journey. When 18 weeks into the pregnancy, they made the switch to a home birth plan with midwives. Each week, they interview other home birth moms and families to hear their birth stories, as well as experts in topics ranging from breastfeeding, sex, postpartum care, doulas, birth photography, and much, much more. They also continue to share their own reflections on their birth experience, future family planning, and navigating the world of parenting together. The Doing It at Home podcast aims to normalize home birth and to encourage mamas and families to be educated, supported, and empowered by their birth choices, whatever they are. You can find the Doing It at Home podcast in Apple Podcasts, Google Play, the Pod Network, Stitcher, and on their website, www.diahpodcast.com. Welcome back to the Informed Pregnancy Podcast. I'm your host, Dr. Elliot Berlin, and we're back with Dr. Emiliano Chavira and Heather, who is taking us on her journey through breech, vaginal birth after cesarean. How often do you say that? Not very often. So what happens next? You didn't go into labor right away.
No, I did not. My baby was taking his sweet time.
Which is different than your first baby.
Yeah.
She had a very early cesarean scheduled and popped right out.
My water broke 2 days after the doctor said cesarean.
Like 37 weeks.
Nope, 36
and
like
change.
5 days. Yeah.
Oh, okay. So this baby went past 40.
Oh yeah. Yeah, he did.
Which is another thing. Sometimes OBs, like, they have a 40, just in general, 40-week cutoff. Oh, baby's not out. We have to induce or cesarean.
Yeah.
How far past 40 did you go?
I went to exactly 42.
42 weeks?
To the day.
Okay. Is there a reason why doctors don't like to go past 40 weeks? Is 40 weeks the end date, the cutoff, the use by date?
There's a reason and there's a rationale. But I think the absolutism and the sort of like fervor and anxiety over it is a little bit unwarranted. It's out of proportion to really what the issue is. So the issue is in the last weeks of pregnancy, every once in a while, all of us who take care of pregnant women see this happen. The baby just suddenly passes away in utero. Mm-hmm. So, in the life of a woman, in the life of a family, this is like one of the most horrific things that can possibly happen. And fortunately, it's a very, very small number. It is clear that as you start to get up to the due date and then past the due date, the risk of this event starts going up. But when you look at it numerically, the best studies on this say that if you're at about 40 weeks, it may be something like 0.5 per thousand. So that's going to be 1 out of 2,000 babies. And when you hit 42 weeks, that number has gone up to like a couple out of 1,000. Mm-hmm. So it is, the risk definitely goes up. That's pretty clear. Nobody debates that. But the magnitude of this risk is pretty small. So
are there benefits to continuing to go?
It really depends on the perspective of the mother and how much she values, the notion of having spontaneous natural labor. Mm-hmm. Because the other alternative is to induce. Well, actually, in the case of Heather, we didn't have the option to induce because the hospital where I work has a policy actually that forbids inducing labor in breech babies. Mm-hmm. It's something that
What about VBACs?
That to me, with VBACs, it's okay.
They induce VBACs?
Well, they do not, but they don't have they don't have a policy against it.
Okay, but not for breech.
But for breech, there's a specific policy that prohibits it. So if we were not going to continue waiting for spontaneous labor, the only other option really was to do a C-section.
Mm-hmm. Is there extra monitoring that happens after 40 weeks? Are there signs that the baby's doing well or not doing well?
The standard thing is what's called antepartum testing. And the most common test that's done is an NST or non-stress test. And you start with an ultrasound. You check the amniotic fluid that's around the baby. If the amniotic fluid is normal, that's presumably a positive indicator of fetal well-being. And then you connect the heart rate monitor to the baby and you listen to the heart rate and you sort of look at the pattern, whether the baby looks very active and has a normal heart rate and not having decelerations, which are events where the heart rate slows down briefly for a few moments. So if the NST is normal, there are some older studies that have cited statistically your chances of having a fetal death in the next week is about 1 out of 1,000 if you've got a normal NST. Mm-hmm. So it's a reassuring finding, and it's pretty standard when you're what's called a late-term pregnancy, which means after 41 weeks, to start NSTs, and that's usually done twice weekly.
Is that what you guys did?
Mm-hmm.
NST is twice a week, and they look good because you went to 42 weeks. Can you ever go past 42 weeks?
Sure. Most pregnancies, that will not happen. There's very, very few women who are still pregnant by the time you hit 42 weeks. So Heather's just a superstar in that way. But sure, I mean, I've heard women tell me that they went to 44 weeks. Now, when I hear a story like that, I kind of think that maybe their calculation of their dates were off. Mm-hmm. It's hard for me to imagine that's possible.
In my practice, the most I've seen is 42.5.
Yeah.
42 weeks and 5 days. And in fact, it was a woman from Israel who she had 2 babies in Israel also after 42 weeks, 42.3, 42.4. Wow. And then here her doctor said, no, we have to induce you at 42 weeks. And so she just scheduled the induction, but she's got like this tough Israeli, attitude. She knew she wasn't going to show up for it, and she just waited a few more days, and at 42.5, she went into labor. And also, she and her sister were born past 42 weeks. It's almost like the oven in that family is set to like 325 instead of 350.
Sure.
I was breech and went past the due date, and my mom had a scheduled C-section.
Right. We have the breech. We were both breech. That's why we get along so well.
Yes.
Were you breech?
I was breech.
You were?
I was born breech.
I was born breech.
Oh, and my gosh.
Was born breech.
It's a fact.
Hold on, one more time. We just if you can only see what was happening now. Okay. So what happens at 42 weeks?
Oh, my gosh. Man, I could barely walk those last few days. And at 8:30 in the morning on day 42, or it was 42-1 or something, I started, mind you, weeks prior, I was sure I was going into labor. I told you I was feeling things, and I probably was feeling things, but man, it took long. And so this morning, like 8:30 in the morning, I started feeling some things that were regularly happening. And I'm like, oh my gosh, I think this is it. And it progressed pretty quickly. And I called Dr. Chavira, and he's like, well, we'll wait and see. And, it could be, but it might not be. Mm-hmm. And
I have just a quick question. Had you been checking your cervix up until then?
So I continued to see the midwife because she wanted to serve as my doula monitrice. Monitrice, yeah. But she had checked me once and said I was not dilated at all. And that was something I brought to Dr. Chavira also about should he check me to see if I was dilated. Mm-hmm. And you said, do you remember?
I don't remember, but I probably discouraged it and thought that it just wasn't that important.
Yes.
Yeah. But it doesn't tell you very much.
Right. It doesn't really have any predictive power.
And that it could create anxiety if I wanted to be dilated and I wasn't.
And introduce bacteria for no reason whatsoever.
Yeah.
Okay, so you didn't know for sure.
No.
Okay. And so how did things go after your?
So I waited a couple hours. I talked on the phone with a couple people.
And you're feeling contractions? Is that what's
really
happening?
mild, but they were regular, and they started to speed up. And so I called the midwife, or my doula, and she came over at around 11
in the morning.
In the morning. So things started at 8:30. She came over about, I think it was like 10:30 or 11. She checked me, and I was 3 centimeters.
Oh, wow.
And you know, I just, things were getting intense. And then at around 11:30, 11:45, she'd not been there long. She told my husband, I think we should go. She goes, you don't want to be, you know, at your pushing stage in the car for your breech birth.
Breech VBAC?
Yeah, for your breech VBAC, exactly.
Breech car VBAC?
Yeah.
Sponsored by Hyundai.
Yeah.
How far were you from the hospital, from where you live?
You know, we got there pretty fast. I actually kept a blindfold on because I didn't want to see traffic.
I do that when I'm driving on the 10 freeway too.
I think we got there in 15 minutes. There's no traffic.
Oh,
at
wow.
that time.
That's really fast.
Well, it was like noon, you know? Yeah. So we made it pretty quickly.
And what happens at the hospital?
They put me in a wheelchair, wheeled me up to the room, and I mean, again, I kept this blindfold on.
Still in the wheelchair?
My whole thing was,
see no evil?
well, I didn't want to feel any stress. I wanted to totally relax and open and not like clench up, because I'd watched a little of Ina May Gaskin, who she talks about breech birth, and she talks about that all fours position and opening the pelvis, and that anxiety, which sometimes can get, you know, women feel in a hospital setting. Why there may be, you know, like on the farm, the Ina May Gaskin farm, their C-section, having to transfer care to have a C-section was so much lower than if you're actually laboring in a hospital. And she's inclined to believe, and I kind of agree, that stress makes everything tense up.
Oh, sure. I mean,
so
we know that for a fact. It's the fight or flight response. It has a very predictable series of responses from your body to stress.
So she talked about the pupils, something about like just first of all seeing the hospital and the fluorescent lights and stuff, but something about keeping the pupils open, just keeping everything open. I thought it was kind of interesting, but it was something that they suggested in hypnobirthing too.
Oh, so you mean the darkness from the blindfold would keep your pupils dilated? Yeah. And maybe your cervix would dilate too. Maybe. You should put the blindfold on your cervix.
I tried.
Hey, new Shark Tank product. Now with Pam non-stick birthing spray.
But what is, and I think you were in the room when they came up to, they send anesthesia, even though I didn't want anesthesia, they still protocol, they send the anesthesiologist up to give you the just in case. And I was very much.
You wanted to feel it.
I wanted to feel it, but I also, I told everyone that came up to give me the protocol spiel. I declined to hear it because I'm in labor.
You didn't want to hear it. Okay.
I'm in pain, and to hear things about, do you understand that your fetus risk of death, you have a risk of death? Who wants to hear that when they're in labor?
So you needed the earmuffs to go with the eye mask.
Yes, I needed it all. I didn't want to hear any of it.
Okay, just pause for 1 second. Doc, at that hospital, is there anyone else who delivers breech?
Yes, as a matter of fact.
There is. So did they see it once in a while? Are they nervous about it? The nurses, I mean.
There was every response from the whole spectrum. So there.
To Heather specifically, or because you do other breaches there? And VBAC?
No, actually, we went to a specific hospital where I don't do breaches.
Oh, okay.
And so it's unfamiliar there, and but there are physicians on staff who are experienced providers who have done breaches, who are not fearful of it, who offer it to other patients who walk in the door in labor breech. So there is some experience with it. On the other hand, in obstetrics in general, it's just such an uncommonly witnessed event that you have a huge number of people who've never seen a breech birth. Maybe their only experience with it is they've heard some horror story about it. And there's just a lot of fear. And when a birth like this happens, pretty much everybody in the hospital finds out about it.
Mm-hmm. Okay.
And everybody brings their own feeling about it and their own reaction to it. And so you get a little bit of everything from all angles.
So the nurse is not very familiar with it.
Well, the nurses who are working with me have worked with me at another hospital, actually.
Oh, I see.
And they were okay.
They were comfortable.
And, I think, in the room, we were able to create a very serene and peaceful environment. I think the biggest fracture of that was from the anesthesiology department that wanted to come in and do their spiel. Mm-hmm. And, I'm in a kind of a difficult position because I'm trying to function as a sort of gatekeeper and keep all of the chaos and the noise outside the room so that inside it's peaceful and quiet and Heather can just do her thing. And so there's a lot of things that I'm trying to block. Mm-hmm. But at the same time, I need to interact with everybody and kind of keep them calm and address their concerns and try to put out fires and appease people. So I have to do this little dance of, trying to let the hospital do its thing to enough of a degree where they can be okay, but not make it so completely intrusive for Heather. So, I let the anesthesiologist come through, and Heather kind of took over and just stopped that process and sent him back out.
Did they want to do anesthesia because it was a breech, or they just like to do it?
No, there were two. There was anesthesiologist, and then there was a guy about maybe just the OR in general. I don't remember, but the female, the woman who was the anesthesiologist, she was lovely. Mm-hmm. She was very I hope you never have to see me again. I know what your plan is, but I'm just letting you know in case. Yeah, I'm here if you need, but there's a certain point you can't turn back. Mm-hmm. I remember that. And then she, when she went on, I think she even asked me if I wanted to hear the rest, if I wanted to hear the risks, and I said, no, I'm fine. And she was really gracious and lovely. And then a young guy, the second one, who came in for some other sort of OR in case I need to see it was in case of something. He just ran off the list of, it's not his fault, but he just went down the list.
You might die, your baby might die, your husband might die.
Exactly. Everyone's going to die. Right. It's, and that's where I just kind of cut him off. And I was like, I can't hear this. Yeah. I decline.
Yeah. So, the thing about anesthesiologists is they are absolutely incredible physicians. Mm-hmm. Very often they're the most knowledgeable person in the room when you're in the OR. Mm-hmm. And they're very meticulous about safety protocols. And if you think about, we have this problem in the administration of medical care. There's all these medical errors everywhere. The group of practitioners that have the lowest rate of errors is anesthesiologists.
Interesting.
They're incredibly, meticulous about what they do. And so part of it is thinking ahead, preparing for emergencies, taking steps in advance. If there's somebody on the labor and delivery floor that, may potentially need to go to the OR, they want to know in advance, is there some kind of medical or surgical history that I need to be aware of? Is this patient's airway normal that if I need to intubate, I'm going to have problems? Or is there something abnormal about her jaw that I'm going to need special equipment? And they want to put all those plans in place. So that it's very hard to argue against that.
Yeah, there's a practical benefit to it.
Right. So, but the thing that that would be ideal is if this could be done in advance.
A couple of months ago.
So that when you're in labor, you can just labor and not have to deal with this stuff because because it's actually harmful for the labor process to be doing it at that time. We just don't have systems in place to handle it the way we should.
Right, but ideally that's the best. You get the best of both worlds. They have all the data they need for safe delivery of anesthesia, should you need it, and then you don't have to be dealing with that while you're in labor.
Yeah.
Right.
So how do things progress after that?
I just remember it hurt real bad.
It was a hard labor.
Yeah. I mean, oh my gosh. Wow. And fast. It just felt like how could it get more intense? But the nurse was lovely. I really liked my nurse. It just progressed quickly. wanted to sit in the dark bathroom. I wanted to sit in the bottom of the shower. No one wanted me to go in the shower, but I wanted to go in the shower, and then I was able to do that. But, I couldn't.
With water or without water?
With water. I just wanted to, have the lights out and have water pour on me and, and be left alone like a cat. But, people worry, and so I got, a little shower time, but I got, the doula.
What was your baby shower?
That because I didn't have one, so that was my baby shower.
That was your quick baby shower.
Yeah, but I just remember it happened fast. And I remember, interestingly, I was committed to doing this all fours position, but that's the position I had to be in. I was most comfortable laboring in during every contraction. I couldn't turn over. I just couldn't. It hurt so bad.
Where were you feeling the pain?
Oh, my uterus. It was
the cramping,
the contractions. I always wanted to know what it was like, and then there was a moment where Dr. Chavira came in. He was sitting on the side, and I was like, okay, the next time this happens, I'm going to ask for an epidural. But then it would pass, and I'm like, okay, I'm not going to say it out loud. I'm not going to say it. But I started calling out Dr. Chavira's name. Dr. Chavira, are you back there? Are you back there? Is it okay? How much longer? I can't tell you that.
And you were there.
Yeah.
Yeah.
Are you being monitored at that point?
I had I think I had on and off monitoring. What's it? Intermittent.
Intermittent monitoring.
Yeah, we were doing intermittent monitoring, and as we got closer to the birth, she just had the monitor strapped on, and I think just kind of lost track of it. So we're monitoring continuously sort of that last stretch.
I remember you telling me my baby's heart rate stayed amazing the whole time.
Yeah, there was no concerns.
What do you do? Is there anything you need to do to prepare for the baby's arrival at the end?
Who are you asking?
You, medically.
Is there anything I need to do?
Yeah, what are you doing during that time? I mean, she's progressing and her labor is getting stronger, more intense, and more productive, it sounds like. But you both said it was a hard labor. How do you define that? Is it because it was so fast, or is it?
Pain-wise.
Just she seemed like she was being pushed to her limit, but you see that in a lot of labors, and I've had this experience so many times where the mom thinks she just cannot handle another minute, and right when you get to that point, you sort of move to the next phase, and you're making progress, and things change, and so I think that's kind of a common experience.
It's interesting.
But it's just a subjective thing. Some people just look like they're just having a harder labor, and this just seemed like a hard labor to me.
Britta Bushnell was on our podcast on the episode called Mythologies, Metaphors, and Childbirth, and one thing she describes childbirth like is whitewater rafting, where sometimes even just 10 minutes into a 5-hour rafting trip, there's incredible rapids that are so intense, and it's scary, and you're working hard, and your heart is beating really quickly, and you're like, wow, this is only 10 minutes into it. When I'm an hour into it, I'm not going to be able to take it anymore. But 15 minutes after that, it could be the most relaxed and peaceful, placid part of the river, and then it could get more intense or less intense later. And I think it's accurate. Labor is sometimes like that. It feels so intense, like you can't take it. If you're at 4 centimeters and it's this intense, how are you ever going to take 8? But 8 could actually be kind of amazing and more relaxed. Maybe it wasn't, but it could be.
It was intense, but there were those thoughts of how am I going to – I need to know how many more times I have to have these contractions. I have to know because if I have a number that I could reach like a goal, but not knowing and feeling this intensity, yeah, it was crazy.
But you never can. Nobody can ever tell you how much longer.
No, of course not. So it's not it's not logical in the moment. It's just grasping for something. And being tired too, I was exhausted. And I hear of these people who have these 42-hour labors or these 36-hour labors. Mine was 12. And
well, but you also already had a kid, a toddler.
Mm-hmm.
I don't know how well you were sleeping in those last 2 weeks, week 41 and week 42.
Well, I remember I called you. I could barely walk.
I remember that.
That pelvic pressure was so intense. So intense. The day before I went into labor, I was walking on my knees at night because I couldn't stand. It was intense.
How do you know when you're getting close? Did you know on your own?
Every day I thought, oh,
No,
this
no,
is
I
it.
meant in labor.
Oh,
like,
in labor?
Yeah.
Getting close to that needing to push, you mean?
Yeah.
I guess I didn't know that either because it was suggested to me by the doula and the nurse to start pushing, try pushing, and I didn't feel like I was quite ready. So how did it finally happen? What was interesting, I had read about this. I had like this weird, it happened like 3 times of boom, 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 where like it felt like my uterus was pushing the baby out and I wasn't pushing.
Ooh, people talk about that.
Yeah.
Like your body is pushing the baby
Yeah,
out.
and it only happened once. And I feel like if I hadn't, I wonder if there wasn't the pressure to forcefully push, if I would have experienced more of those. It was very, very weird and not as painful as pushing. It was very weird. It like jolted me.
Interesting.
Very cool.
So first you tried to push and it didn't feel right, but then you kind of felt your body pushing on its
My
own?
body did that once, and then the pushing, and with Dr. Chavira's, like, he kind of coached me a little on the kind of breath he was looking for.
Mm-hmm.
I was able to connect. Because before when it was suggested to push, I was trying to push and it felt almost more painful. Like it was going against, I can't explain it. It was like.
It didn't feel right to you.
Something wasn't right.
Yeah, something wasn't right.
And then so the second time it did feel like things were more.
I felt like the pushing I was doing, I could feel like, oh, this is what it's supposed to feel like, because it felt like maybe I was moving my baby down. Whereas before I was pushing and it felt like I was moving the baby back up. It was.
It sort of sounds like you're saying at first you were pushing, you just felt resistance, like it wasn't going to go. But then now you're pushing and you feel it's productive.
Yeah. And there's something about just I felt like I was using the correct muscles and method, whereas before I felt like I was, coming up against something. It was not feeling right.
How long did you push for?
It was a little over an hour, I think, as I remember.
Is that typical?
Yeah.
You're typical.
In no way is Heather typical. My recollection. So first of all, my recollection of this whole thing. This is just such a beautiful memory for me. Going through this journey with Heather, and the childbirth was very similar to the breech journey, the last weeks of pregnancy, in the sense that I think maybe a lot of times women will go through their journey and not necessarily share with me explicitly what their concerns are and sort of the mental and emotional process they have to go through. But Heather was very open with me every step along the way about all these things. So we had multiple long conversations every step of the way about a lot of things.
Mm-hmm.
We talked about VBAC. We talked about breech. We came back to that topic many, many times. We talked about the choice of hospital. We talked about your age, how that impacted things. That was a long conversation. And then as we started passing the due date, we started talking about what does this mean? What is, the fact that we're passing the due date? And so all of her, her concerns and her questions, I really felt like I kind of went through this whole thing with her, and I knew exactly what she was thinking. I knew exactly what she was worried about. I knew exactly what her concerns were. And I could also see her, as I'm giving her more and more information, it's kind of starting to all gel, where she's like, okay, I got it. I understand. And it was almost like she had to understand all of this as well as I do. And then, she got to that point, and then the birth itself was kind of like that. Like I remember, you started to struggle, and then she calls my name. And so we start, talking verbally back and forth. And it was almost, I know she wanted to know how long was remaining, and I couldn't really answer that question. But what I could tell her was all of the signs of progress that she was showing me, and that she was doing magnificently, and that everything she was doing was perfect. So I just kind of kept sending that back to her, like, just keep going. What you're doing is working. I see the baby coming. And so, for me, I just feel like we went through every single step of this process together, and it was incredible. It's amazing.
I have a question for both of you. For you, Heather, when you're pushing, is any part of that feel relieving to you or different than the labor part where you couldn't do anything?
I thought the contractions were harder than the pushing. I mean, I was concerned about like that the baby coming through was really going to hurt.
Mm-hmm.
I thought the contractions, if I had to pick, the contractions hurt more than that baby actually going through.
So the final stages were better for you than getting to laboring up to 10 centimeters.
Yeah.
Which is what a lot of people say.
Yeah.
Doc, when an hour of pushing is happening and there is progress coming, but it's a breech baby, because normally we see that little head come out, then it gets a little closer, then it goes back in, comes out. Is all that happening now with just the baby's bottom?
Yep.
And his balls.
Did you come in ball first? Did he come?
Yeah, my husband
Is that the first thing that came out?
My husband said it's Frankenbeans. Well, the bum and then, the testicles and then the penis come out.
Yeah.
I wish I could have seen it.
I have another patient like that. I could probably get the footage for you because that's how hers came out also.
Yeah.
That's her doula. So, and then what comes out? So do the legs are kind of folded up. You were Frank breech at the end, right? So the legs are folded up towards the head.
Right.
Do they come out on their own?
About 70% of the time they do. So your task when you're attending a breech birth is to watch very carefully and see that the baby is doing everything that he or she needs to do to pass through the birth canal. And they follow a very specific order of steps, and you can watch that. Mm-hmm. So first, they drop one little butt cheek down into the into mom's pelvis. So you'll actually see one butt cheek come out first, and it's the anterior one. And the babies are usually facing sideways. So the baby's back is going to be on one side of the mom, and the legs are going to be on the other side. Then everything starts descending and coming out, and you're just seeing the baby's body and legs, but the legs are pressed up against the belly and the chest, if you can picture that. Mm-hmm. And so as this is happening, the baby starts to rotate so that, well, in England they say tum to bum. So the baby's belly is turning in the direction of mom's butt.
Oh, I see.
So the legs, which were initially facing sideways, start rotating toward mom's back. Now, since you're standing behind mom, they're turning towards your face. So now you're looking straight at baby's legs.
Are you on your back?
She's on her hands and knees, and I'm standing behind her.
Gotcha.
So you see the legs descend, and basically the baby's body and legs and everything drops down till really only the feet are left inside the vagina, and then the knees kind of fold and the legs come out. So baby really delivers his own legs. I have not touched the baby yet.
Oh, wow.
The next thing that happens, the baby will do a little tummy crunch. So you'll see the legs lift up into midair, and what the baby's doing, those crunch machines in the gym where you kind of like you hold these bars by the head and you have these bars on your ankles and you have to do a little crunch. So the baby really does that, and what it's doing is it's pulling its arms down and it's pulling its head down. So you look for
arms and hands are
still inside, right? You also take a look at the baby's chest, and what you'll see, if the baby's arms are in front of the head, which is, you really hope that's the case, as opposed to the arms wrapped around behind the head, which is going to make the birth more complicated. If the baby's arms are in front of the head, you see this crease in the middle of the chest. And that tells you that the arms are in the right position. You expect the arms to come out in the next few seconds.
Okay.
So you'll see the tummy crunch, and then usually a few seconds later, you'll just see an elbow come out, and the baby pulls its arm out, and then it pulls its other arm out, and it does this all itself. So once the arms are out, the next sign you're looking for is the head needs to flex, so meaning the baby pulls its chin down to its own chest, and that pulls the head through the birth canal. And you can actually see this by looking at mom's body. The face is actually right behind the mom's rectum. Mm-hmm. And so you'll see it actually bulge out towards you. So if the rectum is kind of receded and mom's butt cheeks are touching each other, the head has not flexed and it's not inside the pelvis. And that's a problem that you're going to need to deal with. But if you've seen mom's, glutea separating and the rectum is coming forward, then you know
The head's moving.
that the head is flexed.
Wow.
So these are all the signs that you're watching for. And if the baby's following all these steps, you literally do nothing. You just sit there and you watch and you allow the birth to happen. And at a certain point in time, if something is not right, the baby's not in the right position, the baby's not rotating the right way, the baby's not doing the things it's supposed to do, then you step in and you basically recreate the natural movements that it's supposed to do. So you help the baby along. But in Heather's case, they were working together and they really did everything until at the very last minute. I helped with some of the head flexion, but it was fairly minimal.
And then baby was out.
Baby was out.
And you got, I assume, immediate contact, unlike last time.
Yeah.
How'd you feel right after your baby came out?
Oh, I first remember pushing the head, and I was like, okay, Heather, just go dark. You're not going to tense up. Push that head out because there's, that's what I wanted to make sure came out safely. And then once I heard he was out, I remember crawling as fast as I could to flip over so I could hold him. And, I got to hold him, and he was so little, and it was really good to hold him. Yeah, it was really good.
Just briefly, how would you compare the two experiences? Because with your first one, you said you were very present.
Mm-hmm. So in hindsight, this is almost 5 months later, going the whole labor itself or not labor, the C-section, the labor, those were both hard. They were both hard in different ways. The end result, so in the first C-section, I did not get to hold her immediately. I heard her crying it felt like forever, but it was probably around 20 minutes, which is forever.
Sure.
And getting to hold my son immediately, that's probably the most important part of my whole experience, actually, when I look back. The vaginal birth was so important, doing it natural, and that is still, I'm proud that I did it, but the end result is what's most important.
That immediate bonding.
And I did immediately bond with my daughter once she was on me. There was no interruption of that, but I just remember it was agonizing not holding her right away. I don't think any mom should have to go through that if it's not necessary. And
did your little guy have hip dysplasia?
No.
Right. Because your daughter did.
No, not hip dysplasia. They both have torticollis.
Oh, she didn't have hip dysplasia?
No.
Okay, she had
She was
torticollis.
head down and he was head up, and both have the exact same spot torticollis.
Oh, interesting.
Yeah.
They must be eating tacos in the uterus. They got taco neck. Any final thoughts from either of you guys?
I'm just very grateful that, that I got to do something that I'm telling you, everyone except Dr. Chavira, except for you, Dr. Bowen, everyone would grimace, would say that's dangerous. Even the VBAC part, I had a nurse come in and say, at the other hospital, I had a nurse come in after you had left, and she said, how far apart are your two children? And when I said they'll be 18 months, apart, and she said that's really dangerous, doing the vaginal birth. When I had an ultrasound and I was, 41 weeks, the person doing the ultrasound, I just could see her face like making that, ooh, when was your due date? And then forget about saying you're going to do a breech vaginal. It was, but Dr. Chavira said, I'll never forget this. I have no doubt about you. And that was hearing someone say that when there's so much doubt is very, very powerful. So I'll never forget that. When you said, I have 100% faith in you, I have no doubt that this is going to be a successful birth.
I love to watch somebody find their options, explore their options, and make a decision together with their providers. So, I don't have a choice for you. Even when we talked last time, if I was in your same exact shoes, and my wife was saying, "What should we do?" I don't know what I would have picked.
Yeah.
It's just such a personal choice. But I think a lot of women who just had a cesarean and want to have a vaginal birth don't have that choice. I think a lot of women who have a breech baby and want to deliver vaginally don't have that choice. A lot of women who go past their due date or all the way up to 42 weeks don't have that choice. A lot of women get aged out now from vaginal birth and wouldn't have had that choice.
And even, I have to throw one more at you. I have a young cousin who had her third baby. The baby was breech. They were going to schedule a C-section, and I wanted to share my experience with her. And she had no desire at all. She said, "No, that's dangerous. Why would I do that?" And to her, finding out more was not important. So for her, it was fine to do the C-section. And she had no interest in.
I think that's okay too.
Yeah.
It's just everybody gets to have their choice.
Yeah.
My ultimate goal with informed pregnancy is that you get to have the information and you get to make a choice. On any of those things that we just talked about, those scenarios, there's always the choice to have the cesarean birth. That's never taken away from people.
Yeah.
It's just the choice to have the vaginal birth is somehow becoming less and less available to more and more categories of people. So I'm also grateful to Dr. Chavira that when patients like Heather come through the office, even with much fewer factors going on, just to be able to say, hey, if you want the option, Dr. Chavira, you should just talk to him and do a little consult. And they always feel better afterwards. I get emails almost at least once a week from someone who says, I think we got one today. I don't know if you got it too. I think you were copied on it too, where she said, we had our abdominal birth and she had talked to you about potentially doing the breech vaginally, but then she listened to the gentle cesarean episode and they incorporated all those principles and she had a really great cesarean birth experience. So it's just about the choice. It's just about the choice. And so I'm really grateful that we have you as a resource and that you're not about to retire like some of the other resources who we have. So there's hope for the future. Do you have any final thoughts?
Yeah, I just feel really blessed that Heather sought me out and that she chose me and that we had the opportunity to do this together. A lot of modern obstetrics is about identifying the remote risk of something that may happen and then running away in the opposite direction, to avoid that risk. And what you lose in that type of approach is the opportunity to achieve something amazing. And I think that's what Heather did. And to have been for me, this was easy. All I had to do was talk. Heather was the one that really had to go through all of this, and I kind of felt like just to be able to accompany her through that, for me, it was just really an incredible experience to watch her grow into this decision to where she knew exactly what she was going to do. And to me, it was just amazing. And I'm so, thankful I got to be a part of it.
And thank you to you, Dr. Berlin, for referring.
Yeah. My part was even easier. I didn't even have to talk. Well, you both inspire me. Thanks so much for being here. At home, thanks for listening. If you have thoughts or comments, share them with us. You can write to info@informedpregnancy.com or your own experiences. We'd love to hear about them. You can also visit us to find more information about pregnancy, childbirth, and early parenting at informedpregnancy.com.
Give me the news, I got a whole lot of questions for you. This kid's gonna test my will, I got a lot to learn and my babies do.